Doctor, I was asking about the term signal tumor. Can you explain what signal tumors are?
Well, signal tumor is a word that has been used in science, but or in medicine and epidemiology. What it means is that if you detect a tumor in an individual, you should suspect a certain exposure. So lung cancer is a signal tumor for smoking. If a patient walks into the clinic and is diagnosed with lung cancer, it's incumbent upon the physician to inquire about past smoking habits, because most lung cancers we know in the United States are associated with cigarette smoking. If a male particularly walks into a clinic and is diagnosed with a pleural mesothelioma, then you must ask, a physician must ask for possible exposure to asbestos, particularly amphibole asbestos, because we know that historically a large number of pleural mesotheliomas among males were being caused by exposure to amphibole asbestos. That is what signal tumor means to me, and that is my interpretation of signal tumor. A signal tumor is not the same as I gave you the examples earlier on. When you talk about the chickenpox virus in chickenpox, that's not a signal disease for chickenpox virus. It's the definition of the disease. Chickenpox cannot be caused by anything else than the chickenpox virus. Whereas we now know that mesothelioma can occur spontaneously. We know that it can be caused by exposure to amphibole asbestos. We know that it can be caused by exposure to aerionite, and we know that it can be caused by exposure to radiation. It's a multifactorial disease.
Are there other forms of cancer that are spontaneous, doctor?
Well, every form of cancer can occur spontaneously.
Sustained.
Now, we've heard in this case about the notion that there's no safe level of exposure to asbestos. Do you believe that to be true?
Well, there are multiple well-conducted epidemiology studies that show that exposure to low levels of chrysotile asbestos, even if it's contaminated with some amphibole, does not increase the risk of mesothelioma. So I believe that there is a practical safe level or a practical threshold for exposure to chrysotile asbestos, below which there is no increase in the risk, or an increase in risk cannot be detected in well-conducted epidemiology studies.
So does epidemiology tell us whether or not there's a threshold below which disease will not occur?
Well, that is a logical contradiction, because one runs into issues of what in statistics is called power. So the ability to detect a positive effect depends upon the size of the study. So we have 20 epidemiology studies, all of them showing no association with exposure to low levels of chrysotile asbestos. So that, to me, is convincing evidence that below that there is no increase in risk. However, you cannot state that on theoretical grounds, because someone might come along and say, you should do a much larger study, or you should do 50 or 100 studies, and then you might find something. But 20 studies for me are pretty convincing.
As an epidemiologist?
As an epidemiologist.
And a carcinogenicist?
Yes.
Sir, what evidence do you rely on, then, in your opinion, that mesotheliomas can spontaneously occur?
So I've gone through the biological evidence, and we can. So I think we've. Can I go through this very quickly?
Yes, if you wish to step down, you may sit down.
Well, so. Okay. the epidemiology of mesothelioma, which I've already gone through, it occurs spontaneously. There is increased risk with exposure to amphibole asbestos and high levels of commercial crucible asbestos contaminated with amphibole. There is affirmative evidence, as I just said, of no increased risk following exposure to low levels of crucible asbestos. There is increased risk with exposure to ionizing radiation and with exposure to erudite. So, what is the evidence that, like all other cancers, mesothelioma can occur spontaneously? So, in many epidemiology studies, carefully conducted case-controlled studies, where all cases and all controls are carefully asked questions about their exposure, either in the job setting or specifically to asbestos. Many cases report no asbestos exposure. Then, many of the so-called population or registry-based case control studies can be used to do a formal calculation of the fraction of mesotheliomas that are attributable to asbestos in epidemiological studies, and they are always less than 100%. So in the United States, for example, the fraction of pleural mesotheliomas among men that occurs without any asbestos exposure is between 15 and 20%. It is consistent if you study mesothelioma incidence trends, the conclusion that mesotheliomas occur spontaneously is consistent with these incidence trends.